Welcome to We Are Old, Get Over It, the podcast for active senior living and getting the most out of life. I'm your host, Ken Gluckman. During our summer break, we share highlights of some of our favorite conversations from the past year. These are just short clips from the full-length episodes. You can find the link to the original episodes in the show notes here, or just search the episode title on our YouTube channel or in your preferred podcast app. Help us share this useful and informative information by inviting your family and friends to visit our podcast. Share a clip or an episode with them, and it will give you something to talk about. And now, let's laugh and learn for the week. Should the individual, when they start taking on a sport, like let's say, for example, someone like myself who used to play tennis, hasn't played tennis for 20 years, and all of a sudden I meet you and you say, well, you want to play pickleball with me? Yeah. What lifestyle modifications should I be making in anticipation of playing, not as necessarily a competitive sport, but a sport that becomes competitive and is a social sport?
Yeah, I mean, that's the biggest challenge with pickleball and why I think we see so many injuries is it has a very low barrier to entry. It's not I need to be conditioned like you would in tennis, before playing. You don't need, a significant of strength, but you just pick up a paddle and, go out and play. But if someone hasn't played for the last 20 years, it just primes those, acute on chronic injuries, those tendinopathies to become inflamed, the knee arthritis that maybe was laying in the background, but there's some wear and tear in that area now. And also even things like balance. Our balance is affected as we're getting older, and we can increase our risk of falls if we're not, building up those core muscles before we get out. So I wish there was a foolproof plan of, hey, if you do X, Y, Z, you're going to be safe on a pickleball court. But I think, like anything, moderation is going to be key. You're going to have to ease yourself into it and then find that level of play that doesn't tip you over, because we're all going to have different thresholds. Someone's going to be able to play 5 days a week. I may be only able to play 2 days a week, but at least when I get out there, I can go out and go full go. But 5 days a week, I'm going to be in the doctor's office.
So you would suggest that they do a warm-up procedure no matter what. They stretch, they stretch in different ways, and I'm sure
stretching is fine. Stretching is going to improve your elasticity, help with your neuromuscular feedback, which are all good for the long term. But the most important is what you said first is more of an active warm-up. We're going out to play. The stretching is important, but it's more of, don't go cold right out onto the court. We need to get that heart rate going, get blood flow to the muscle groups to warm up. And that has much more evidence than maybe just an aggressive stretch program before you go out there.
What is the most common injury that you're treating related to pickleball, for example?
All right, I'll give you a top three because I think that's an easy one. So if we start at the upper extremity, we're going to see a lot of what we call rotator cuff impingement. So with pickleball, we're talking about a lot of reaching, overhead hits, and that's going to put pressure and basically pinch the rotator cuff. So when the rotator cuff gets upset, maybe because repetitively it's getting irritated, or maybe there's a small little partial tear or fraying, it causes bursitis, which is inflammation that wraps around the muscle layers of the rotator cuff and causes pain at time, wakes you up from sleep, really limits your reaching ability. So I'd say that would be in the top three. Second would be tennis elbow. So tennis elbow is pain right on the outer portion of the elbow. Repetitive. Again, that area is really poor blood supply. So when we strain it and stress it repetitively, pain is really hard to get away, to go away. And then finally, an exacerbation of knee arthritis is very, very common, meaning there's some wear in the meniscus, our stabilizing structures, a little thinning of our cartilage. We go out, we twist, we bend, and basically those inflammatory cells come to the knee, cause swelling, pain. And that's usually when we get you back in here.
And how do you treat all three of those items if someone comes into you? Because you do non-surgical, correct?
Yeah, and most of these, we'll be able to get fairly good progress with non-surgical treatment. I mean, at the end of everything, yes, full thickness rotator cuff tears are going to potentially require surgery. Bone-on-bone knee arthritis may require an arthroplasty or replacement. But, first line measures, whether it's just first, hey, how many days a week are you playing? Well, I was on a trip and I played 5 days a week. Right. Well, maybe we need to cut back on that first, so making those lifestyle modifications easy change to make first. Then we're going to go into, well, what have you been doing to, strengthen the core muscles? What are you doing to work on the rotator cuff and the scapular stabilizers? So we'll take that rehab approach next. And then depending on the level of acuity, that's when do we need to put a steroid in to decrease the acute inflammation? Or do we need to say this is more of a chronic tendonitis or a chronic arthritis picture and focus more on the biologics, PRP, what we call bone marrow aspirate, things like that stem cell category to help try to, make lasting improvements with, a procedure or an injection.
What other suggestions would you have for people who are just starting out? They've just retired and they say, geez, all of our friends are playing pickleball and it's a very social sport. What would you suggest for them to try out?
Yeah, so I think, the good news is, like we said, you're going to be able to get out there, but I think it's getting out there in a timely fashion, meaning, you know, same kind of algorithm. Make sure that you can go for a walk for 20 minutes around the block without developing knee pain first. Make sure that you can, go to the gym and complete an upper body workout without waking up the following morning with severe shoulder pain. And then if you can do those things, that's when, do a practice session, see how you feel, kind of take your body through this kind of tough word, acclimatization. I'm butchering that word,
That's
but you
okay.
have to acclimate
I
your
butcher
body.
a lot of words.
Yeah, that one always gets me, and I try to avoid it with patients. um, but you have to ease into it, is a nice way of saying it. Take your time.
So, any final thoughts about what you think you would like to get out there, since you are known in Naples at least as the pickleball doctor?
Yeah, so I think the important thing is, we can treat acute pain. That's not going to be our issue. We'll get things to settle down. I think the hardest thing that we see is, those repetitive injuries and setting the expectations that if there is a partial wear and tear, rotator cuff tear, it's not going to regrow itself. A lot of this stuff, despite our best efforts of injections, therapies, we're not going to fix it. It's still going to be there. Now, it may be less prevalent than it was before, but it won't be back to normal. So it's really finding that middle ground. How many days a week can we play at a high level without tipping ourselves over, knowing that despite, care, we just may not ever get back to complete what we define as normal, for the patient.
Have you ever had anyone retain you to be their medical backup when they're as either a professional or semi-professional player?
So what we cover, previously I've worked for Florida Gulf Coast University, the Florida Everblades. So more of that relationship where we take care of the athletes for the university system. We attend their games, a lot of sideline coverage, late nights in the training room. So that's treating different sort of injuries. Population, we're seeing much more of the acute ligament injuries, the acute meniscus injuries, more of an acute than acute on chronic.
Hey, any final words you'd like to say? I do have one question though. I have one question after. Let me ask my question first, and then you can answer me. So, if I come back to your practice, do I have to wait for half an hour to get to see you?
I think we're one of the faster offices around
I'm
town.
just teasing
But
you. I just wanted to see the
yeah.
reaction.
So, I think the things to think about now is, we kind of we briefly alluded to, kind of these general guidelines. I
Yes.
think in the field of non-operative ortho, this big push has been to kind of that orthobiologic standpoint. And that field is just, even though we've talked in the past about platelet-rich plasma and stem cells, it's really just becoming standardized. So I think a lot of the misconceptions are, hey, I saw a study or I read a paper that, PRP does nothing, or, stem cells aren't real. It's finding what are the as a field, we're trying to standardize these things. We're trying to get to the point where if we do a platelet-rich plasma injection, which is a blood-based one where we take your blood and we spin it around and basically inject your platelets back in. Whereas we used to just take a varying amount of blood. Some studies said 5 cells or 5 cc's. Some did 20. We're trying to standardize it and basically say, if you're going to do an injection for knee pain with PRP, you better have 10 million platelets. So we're using cell counters to make sure that there's actually some standardization with these approaches, because this blanket one size fits all, I had a PRP, I had stem cells, when you really get into the details with patients, what they had probably wasn't going to do anything anyways. So the big thing to be cautious about with non-operative care is make sure you're getting it from someone who's up to date on the literature and is doing things with cell counts and protocols that are being basically established in real time almost.